liquid sulfur, Shankar Basma, impact sharp, that is sharp treated from the tamarind. It contains all the 5 types of lavan, that is Saindava, Savarchala, Samudra, Audhigam, Bid lavan. It contains Limbu, Sirkatu, Vastana, that is Aconitum syrup, and it is processed with the lemon juice. Shankavati, it has got deepen and Pachan action. It improves metabolism, digestion metabolism. It is indicated in all kinds of indigestion, flatulence, dyspepsia, nausea, vomiting, and all kinds of pitta disorders where durvadi, the liquidity of pitta has been increased, vitiated. In that, Shankavati is advised. Action of basti is one of the Panchakarma procedure. There are 2 types, Niruva and Anuvasan. Niruva is mostly this oil and medicated ghee are used, or this fat of the animal, etc. Whereas in Niruva decoction, and it is contain quantities comparatively larger than the Anuvasan basti. Patient lies in the left lateral position. This position is important for the administration of basti. Otherwise, if you give in lithotomy or any other position, basti won't give desired result, and it will come out immediately, or sometimes it also causes some complications like vomiting, etc. Some research has been done. It shows that Anuvasan basti reaches up to the sigmoid column, whereas Niruva basti reaches up to the idiophyseal junction. So we can safely give it into this ulcerative colitis to facilitate the healing of the ulcer. Tiktak has wound cleaning and healing property because of dominant tiktak in Kashaya Rasa. It has got wound healing and wound cleaning property, and as it is shita, that is cold in potency, arrests the bleeding. So this is the drug of choice in case of ulcerative colitis can be used. Durvadi, it has got specific hemostatic action. It is common practice in India that whenever there is epistaxis in summer season, we prepare extract the juice of this durva and mix it with sugar and put it as a nasal drops to reduce that epistaxis. It also has wound healing property, and a mixture of oil and ghrita produces excellent wound healing and also prevent stricture formation. Whenever wound heals, it due to cicatrization, there is stricture formation, which causes later, if it is in the mucosal surface, it can cause stricture and causes intestinal obstruction. So this mixture of oil and ghee, it gives lubricating effect and prevents the stricture formation. Conclusion: ulcerative colitis is an autoimmune disorder and also categorized in the inflammatory bowel disease. It is idiopathic as per the modern medicine. The cause is not known. Mostly affects the older population, not commonly found in young person, where it's found after mostly say around 50 and 60 years old. Mostly males are affected than females. Clinical features estimated there is a bloody diarrhea with abdominal pain of longer duration. It also includes extra-intestinal features like osteoarthritis, iritis, etc., and other liver disorders. Diagnosis can be done by confirmed diagnosis can be done by colonoscopy. You get direct visualization whether it is exactly ulcerative colitis or any malignancy is there. So treatment can be done, and you can take while doing colonoscopy, a piece of tissue can be taken and sent for the biopsy to confirm it. Ulcerative colitis has got a specific nature that if person has discontinued treatment, it can remain silent for around 2 or 3 months. There is no any symptomatically it remains silent, but that ulceration remains, but it remains symptomatically outside. Patient is that I am alright. So because of this nature of the disease, patient tends to discontinue treatment by himself. So whenever we deal with this ulcerative colitis, we have to advise the patient that don't discontinue the treatment until or unless doctor advises you to do so. And the patient has to be kept under surveillance. It is mostly found in westernization of diet because western diet contains less of fiber and more of meat products. And due to the intake of carbonated drinks like soft drinks, etc., it is found in that condition in Western countries. But now as there is acceptance of Western culture into this Eastern Asian and India, so it is also found to occur in our Indian population also. Most common treatment advised in modern medicine are steroid, either it is given orally or also given as enema. For conservative management along with 5-alpha salicylic acid compound, and surgery is indicated when there is complications like intestinal stricture or there is obstruction or there is high level fistula or the ulcer tends to bleed or there is perforation. or there is any megacolon, etc. So in that case, surgery is indicated. Otherwise, it can be managed well with the conservative management. And patient should be kept under surveillance. Once a year, we have to repeat the colonoscopy, whether this is actually cured or not, or it is just gone into the asymptomatic, or it has been converted into malignancy. Because ulcerative colitis, when there is study that when ulcer is subjected to the continuous irritation, when any wound is subjected to continuous irritation, it tends to convert into the malignancy. Best example we can see is the gastric ulcer. When gastric ulcer it is not treated into the time, or not corrected, it tends into the convert into the malignant condition. Similarly, case happens here. In Ayurvedic classical text, there is no direct description of ulcerative colitis.
Okay, we have to go for the discussion session also.
Yeah, this is the last. Then Nidan conversion. Whatever causes are mentioned for the Ghranian, whatever factors that increases the pitta dosha, we have to prevent it. It can be identified under the Ghranian Kapasya Katavana. Treatment can be planned according to the level of vitiated dosha. Basti is an excellent treatment in ulcerative colitis. And Sakura diet has also got cumulative effect, that is facilitate wound healing as well as reducing inflammation, and also it has got multiple nutritional values. So there is no risk of nutritional deficiency. And for Rasayan, that is for prevention, we can use Dadimati with the other medicines. This is the sole aim of the Ayurveda, that let all the world be free from the disease. Thank you.
Although the time is much more, but if any question from any gentleman. Anybody? No?
How many kinds of Yua and Anuvasana are used?
Classically, which actually minimum 7 days it is advised. Minimum 7 days. So we have to start with Anuvasana Basti, and then alternatively Nirva Anuvasana, like that you can start, or one Anuvasana, second Anuvasana, third Anuvasana, one Nirva Anuvasana, like that you can start. The idea of selecting Anuvasana Basti on the first day, because Anuvasana is prepared from the ghee and oil, which are anaktas in nature, and it is opposite to the Vata dosha. So when we give Nirva Basti, it evacuates the feces, it empties the colon. So when there is empty space, it will be filled with the Vata dosha. Whenever there is empty space, air occupies. Meaning Vata is similar to the air, so it fills the air. So to prevent that, first we give Anuvasana Basti to control the Vata, and then we give Nirva. If person is suffering from severe, there is picoline and etc., then we give Nirva Basti first to evacuate the feces, and then after having food, we give Anuvasana. Anuvasana has to be given on full stomach, whereas Nirva Basti should be given in the morning on preferably on an empty stomach.
And you have shown the result, and ulcerative colitis is not completely cured.
Yeah,
so he has to go for second session of this Basti.
Yeah, we have advised him. Right now he is going under treatment, undergoing that Basti.
Okay.
So another set of 10 Bastis we will give. Then we will assess accordingly and will advise the future plan.
In your Basti, after 1 or 2 days, gradually the frequency of evacuation came down, and at one point there is a constipation developed. Right? At one day there was no
Basti was not passed, but patient passed the stool.
Passed the stool.
That oil was not thrown out. Basically, we give Anuvasana Basti. The next day, patient tells that, yeah, I have got this some ghee or whatever you anima given. It has come out with the stool. Mostly we give in Vata Vyadhi person, that is in vitiated Vata dosha for arthritis and or paralysis patient. In that cases, we observe that Anuvasana Basti on the next day, some quantity, say about 10-20 ml comes out. But in this case, on the third day it was absorbed. Either it has got, because we have given, actually we have selected Basti for the healing of the wound, not as a drug administration.
It didn't develop constipation.
It
It after the bowel movement.
Yeah, proper bowel movement was there, and frequency of diarrhea was reduced, which was positive sign that treatment is working. So so we continue with the treatment. Otherwise, if there is any complication, we stop that treatment and we go for another treatment.
In your internal medicine, almost all the metals have been added.
Yeah.
Since it's a lifelong disease or autoimmune
Yeah,
disease,
because
whether you are planning to give lifelong to the same metal drugs?
No, we have discontinued the treatment and patient is now on the only takra. And now after this basti, we will for 1 month we will put it on takra and then we will start dadimati. And along with this odan and the rice, semi-solid rice added with ghee and all, which will pacify pitta and vata dosha, and which will also not increase the copper. So dosha, prime aim of the treatment is to restore the agni, that is metabolism. We should preserve the agni and we preserve the equilibrium of the dosha. So the health